There's lots of good data now that supports they are safe and effective in pregnancy. And just last week we had a study that showed that protective antibodies are transmitted through breast milk to the infant as well. So I encourage all pregnant women. I can say unequivocally these vaccines do not affect fertility, both in women or in boys or in young men. They do not affect fertility.
There's no way that they can do that.
My name is Aurora Bison-Monpetit.
My name is Dr. Charles Hoffe. I'm a family doctor from southern British Columbia.
On November 15th, 2001, I was one of the thousands of nurses that was fired for not providing my employer, PHSA, with my personal private medical information.
When I started to see very serious side effects in my own patients, within 3 months of the onset of the vaccine rollout, I had one patient who died suddenly after his shot. I had 3 people who were clearly going to be permanently disabled and a number of others who were seriously injured.
And we have had one question, but that question refers to a clinical matter. And as a result, I have referred that question to management to respond directly to the individual. So as there are no other formal questions.
I'm actually here from the public with another question.
Yes.
If I can come over there so that the members of the public can see my question that I have. That's all right?
Sure.
Thank you. I appreciate you having me in here today. So my name is Aurora Bison-Monpetit. On November 15th, 2001, I was one of the thousands of nurses that was fired for not providing my employer, PHSA, with my personal private medical information, specifically if I had received the COVID-19 injection. It has been just over a year now, and my assertions that the injection is not the panacea for stopping either contraction or transmission of this virus that you have asserted it to be have been overwhelmingly substantiated.
Pfizer has admitted it lied about its COVID-19 vaccine efficacy before it entered the market.
It is commonplace for those who have received their 3rd, 4th, 5th doses to get COVID, even if they've been vaccinated. Surely you can all see that the current strategy is not doing what it was purported to do.
There's no way that they can do that.
You demonize those like me, stating that we were a threat to patients, the public, and the healthcare system, while you hypocritically ask nurses with active COVID illness to continue working in the healthcare system. Somehow, magically, vaccinated nurses who are sick are not a risk to others, but non-vaccinated nurses who are healthy are a risk. I fail to glean even a shred of logic in that. Perhaps someone here can enlighten me.
There's no way that they can.
So here we are, more than a year later, our healthcare system on the brink of collapse, and the healthcare worker injection mandate continues to be in effect. Despite the vast amount of evidence discrediting the validity of the order, despite every other province in this country and many countries around the world acknowledging this approach is neither scientifically sound nor effective, despite the tens of thousands of COVID-related sick calls all of our health authorities have received after the non-vaccinated healthcare workers were fired and thus not spreading COVID in the workplace. So again, perhaps someone here can enlighten me as to what is different in BC. Last week, November 16th, 2022, I emailed the entire board of directors and executives of PHSA with an investigation summary into how PHSA has handled COVID management. Who among you did not receive this email? Okay, I'll take that everyone received it. I have on hand a printed copy of this email for each of you, so there is zero plausible deniability that each and every one of you has been personally provided with this information. As a reminder, in this email, I quoted PHSA's Stop the Line policy, which states, this is a process to clearly express patient safety concerns, and when asked to do so by others, stop and immediately respond to an expressed patient safety concern. I first raised my concern to the board and executive a year ago, November 24, 2021, when I submitted a question for an open board meeting. My last question submission on April 28th has yet to be acknowledged, let alone addressed. In this email, I shared under PHSA's whistleblower policy some of the alarming red flags I noticed related to COVID while working as a nurse for PHSA. Namely, the huge discrepancy in adverse vaccine reactions occurring versus those being reported to the public. We haven't even begun to delve into the responsibility PHSA holds as the employer of Bonnie Henry and the parent organization of the BC CDC. In this email, an abundance of credible resources were included. I have yet to receive a response from a single one of you. Not something I would expect from leadership of an organization like this. The public health measures, including but not limited to the experimental COVID injection that you have facilitated, promoted, and mandated are causing significant morbidity and mortality in this province. In Pfizer's own post-market trial data, in the first 3 months, ending February 28, 2021, their own data reported several pages of adverse reactions, including over 1,200 deaths. Myocarditis, among other cardiac issues, severe neurological issues, and a horrific rate of fetal demise in mothers who discovered they were pregnant when they received the injection.
There's no way that they can do that.
The increased all-cause mortality and decreased live births have been impacted globally at rates never seen before, not even close to it.
They can do that.
Our healthcare system was already failing before COVID. It is now on the brink of irreparable dysfunction. I, as a nurse, one of the many thousands, am now on welfare and lining up at the food bank every 2 weeks because you continue to uphold a mandate that is not scientifically sound, ethical, moral, or lawful. How do you sit right with yourselves doing this? Are you really so obstinate as an organization and as leaders within this organization that you would rather watch our healthcare system implode than acknowledge your wrongdoings and take steps to remedy them? So my question to you, as I've provided all of you with ample information, credible resources, every single one of you received this email. Has this information been looked into to a depth that you can, with 100% certainty, say, this woman is out of her mind and she's making stuff up? Because if I'm wrong, I'm just one delusional woman. If you are wrong and you are ignoring these warning signals that I've sent you, you are continuing to contribute to the grave harms and murders of people in this province. So are you 100% sure that the information that I have sent you is not correct? That is my question to you.
Great. I have reviewed the information, and I too am a registered nurse and feel quite confident with the evidence, yes.
So you reviewed all of the information in my email?
I just actually answered your question to me, and I feel, as a registered nurse, completely confident with the information, yes.
Question has been.
Okay, and I get one follow-up question.
Follow-up question.
So you said you reviewed all of the information. Does that mean the information that I sent you?
I have reviewed your information, and I am confident in the evidence the province is using.
Shame on you. I will leave. Shame on all of you for not looking into this. There will come a point in time, and it's becoming more and more obvious.
My name is Dr. Charles Hoffe. I'm a family doctor from southern British Columbia, where I've worked since 1993. I serve mostly the Nlaka'pamux First Nations people. When the vaccine rollout began, I tried to alert my colleagues in the area to serious safety signals and was reprimanded by the authorities and told that I was not allowed to say anything negative about the vaccines. And so when I started to see very serious side effects in my own patients, within 3 months of the onset of the vaccine rollout, I had one patient who died suddenly after his shot. I had 3 people who were clearly going to be permanently disabled and a number of others who were seriously injured. So I sent an open letter to the British Columbia Public Health Officer, Dr. Bonnie Henry, to inform her of these safety signals. Her response was to refer this to her top vaccine safety specialist, Dr. Monica Naus, who assured me without any investigation of any of my patients that these were all coincidences. So I said, well, I said to her, I've been family doctor to these people for 28 years. I know them very well, and there is no other medical explanation for these terrible, disabling symptoms that they have. She insisted that they were all coincidences and told me to just submit vaccine injury reports. So I started submitting the reports, and ultimately I submitted 14 in total, and when every single one was denied as a coincidence by public health, I gave up. To this day, I have 36 vaccine-injured patients. This is just the COVID vaccines I'm talking about in my practice, and I have a small one-man practice of approximately 1,100 people. So the second response of the authorities to me trying to alert them about what was happening to my own patients was to send a warning letter. The College of Physicians and Surgeons sent a warning letter to every registered doctor, warning them that if they spoke misinformation about COVID or the COVID vaccines, that they would be investigated and, if necessary, disciplined. In other words, this was effectively a gag order to the entire medical community. These shots are safe and effective. Don't say anything to the contrary. You will be putting people at risk. So ultimately, I was charged with spreading misinformation. And to cut a long story short, after they eventually dropped those charges, shortly before my trial, because I had a brilliant lawyer and 8 world-class expert witnesses to defend me, the only reason that the college could give me for why they dropped the charges is that this process has already fulfilled its purpose of acting as a deterrent to other doctors who may wish to spread misinformation. So this gag order, this warning to doctors to not spread what they called misinformation, effectively created an illusion of consensus. Because the doctors were too afraid to speak up, all the doctors thought that there were very few doctors out there trying to raise the alarm of what was happening, because it was clearly devastating. And I pointed out in my letter to Dr. Bonnie Henry that at that point, which was 15 months into the pandemic, we had not had one single person in our town needing any health care for COVID at all. And as soon as the vaccine rollout started, then the real problem, the real casualties emerged. And I pointed out to her that it was clear to me that the COVID injections were more dangerous than COVID. So, of course, the response of the authorities is, well, yes, it's unfortunate if a few people get hurt, but the vaccines are saving millions of lives. They are keeping people safe. So one needs to keep in mind that in the first year of the pandemic, there was absolutely no increase in the number of people dying in Canada. If we look at all-cause mortality in the first year of the pandemic, it was no different than what we would expect. The increase in all-cause mortality started after the vaccine rollout. In the United States, they have now had approximately 1 million excess, these are non-COVID excess deaths since the vaccine rollout. So this idea that the vaccines have saved millions of lives is absurd. The number of people dying is higher than ever. The the open VAERS. So as I mentioned, vaccine injury reporting in Canada appeared to be censored, as I discovered, when literally of the 14 reports that I submitted, 100% rejection from public health. So we have to look to other nations. Since Canada had a censored vaccine injury reporting system, so the open VAERS in the United States records 39,000 people who died unexpectedly within 28 days of their COVID shot. 39,000. And 72,000 who were permanently disabled within 28 days of their COVID shot. And they continue to tell us that this is safe and effective. There seems to be no ceiling on how many casualties there need to be before they shut this down. So I am part of this Allison Inquiry, advocating for the safety of my own patients and for all Canadians. Thank you.